healthcare. So in that case, we always say, so do not make it like 1 liter. Just ask them to, like those Tetra packs are available in 200 ml only. उतने ही आता है. So basically, we always say it's very difficult to manage, but simpler ones are एक चुटकी नमक और एक चम्मच sugar डाल देना है. Potassium might be a problem in those things, but some of the salts are supplemented with like iodine and potassium. Of course, that we cannot take care of that part. But to begin with, early जो retrieval के लिए early signs of अगर दिख रहे हैं, तो at least there can be some salvage with this mechanism of एक चुटकी नमक, एक spoon sugar, and just 200 ml of water, and keep making it. Make sure that the child is drinking at least 50 ml every hour if it is a child of 1 to 2 years age group, because that is the basic maintenance. Plus thoda sa 10 ml extra which is required for feed your body. There are a lot of Ashawadi workers actually, they do a brilliant job in so as remote as Palghar or Boisar or this side, like when you go to Murad. So I think the access is always there. We just have to make sure that the parents are able to visit at least the Ashawadi workers or the family healthcare in that location.
Delivery improves. These three components also apply to these kind of ORS also? Is there misuse of excessive use can have some kind of side effect?
Brilliant question. So, ORS is something which is naturally there. हम लोग जो भी लेते हैं, like ORS basically needs sodium, potassium, citrate, and plus water in that amount. Water excess, your body has such a brilliant mechanism to just wash it out. So if your kidneys are fine, everything is fine, it's just going to wash out on its own. If you are going through according to the WHO approved formula, again your question is valid. Then there can be a side effect for the ones which is not WHO approved, because in those cases, as we said, the diarrhea can worsen because diarrhea में potassium निकल जाएगा. Once potassium is down to below 2 something, you can have heart effects, like it's a cardiac death most of the time. So heart is involved first thing, plus the muscles, plus the kidney. So number one is your acute kidney injury अगर proper amount में नहीं दे रहे. Second, potassium अगर थोड़ा भी ऊपर नीचे हुआ तो of course your heart and your muscles can be compromised in those cases. So again, always go for WHO approved formula. The way to check that is by urine output. The simpler ways is like urine भी yellow था, अब normal होने लग गया है, और बच्चा अगर बाहर जा रहा है आपको urine cut down भी होगा तो child is highly affected. And then the sunken eyes जो दूसरी भी आती रहती है, that will be better. जो skin turn हम check करते हैं ऐसे देख के, तो skin turn check करने में एकदम लूज हो जाता है, जो कि hydration के बाद normal होता है. So if the diarrhea is something which is not manageable at home, like diarrhea हो ही जा रहा है, you're giving the kid a lot of ORS back to back, it's been 12 to 24 hours, then definitely we will need IV hydration, and we need to make sure that there's no infection, because it might, not all diarrheas will need, like rotavirus doesn't need antibiotic, it's a virus, but yeah, bacterial diarrheas will need antibiotics. So in those cases, admission and then sending us to culture and further workup may be required.
Thank you very much.
Thank you.